Hello, my name is Ellie Cormier, and I will be talking about fall prevention. So, first of all, we're going to do an activity. So, I want you to look at this first picture with the couch, and I want you to identify any fall risk factors. And then I want you to look at the second picture with the floor and see if you can identify any fall risk factors. So I'll give you a little bit of time to do that. Okay, so for the first picture with the couch, if you identified the pillow on the floor, the glass table is too close to the couch, and the pillows could be put away because it's scattered all over, you are correct. And for the second picture, if you identified the basket is in the walkway, the different objects could be put away, the things on the floor, it could be organized better, and the carpet, the rug, is turned up, you are also correct. And if you see in the very corner, there is electrical wires, and those are also in the way. So some of these things may seem obvious, but some not so much. So for the first picture with the furniture, it would be difficult to maneuver that, and that's a fall prevention. And of course, with the things on the floor, that can be difficult to maneuver around. And when things are scattered all over, that can get in the way and cause people to trip or fall over. So we want to make sure things are organized, and we want to make sure walkways are clear and just generally anything off the floor. So those are a few of the fall risk factors. So what do you think? I want you in your head to just think about these questions, and we'll review it at the end of the presentation. So environmental factors that can cause falls. What do you think those are? So just come up with two at least and identify what you think those risk factors are. Behavioral factors that can cause falls. So once again, can you think of at least two? So what is the dangers of falls? The definition of falling is to unintentionally come to rest on the ground, floor, or other lower level. Unfortunately, it is the second leading cause of injury leading to death. People who are 65 years and older have the greatest number of fatal falls. Due to the falls, it can lead to difficulties in other areas of life, such as activities of daily living, instrumental activities of daily living. And what that includes taking care of ourselves, like brushing our hair, brushing our teeth, making meals, driving places, taking care of grandchildren. So our falls can affect all of those things. If someone falls, it also can decrease leisure and social activities. So they're less likely to go out to the church or to the community or gardening because they have an injury. And fear of falling leads to less activity. So because they have a fear of falling, they may not engage in activities they used to, like gardening or walking the dog. So there is a lot of dangers of fall that can lead to physical, and then it can lead to further decline overall. So falling includes complex interactions. So there's many different things that affect falling. So biological, your body, the physiological body is declining. Behavioral, along with our body, cognitive can decline. So that can dementia and Alzheimer's can affect falling. Environmental, so what's in our environment. So the weather, snow, that can affect it. Socioeconomic, so maybe if someone can't afford fall prevention things, they have an increased risk. Complex medications. So if people are doing their medications incorrectly, this can cause falls. Housing, the type of housing you have. So do you have steps? How many stories do you have? That can affect it. Functional performance. So how well can you perform? Maybe because of a declined body, you can't perform as well. Mobility impairment. So maybe someone needs to use a walker and they're not using it right, and that can increase the falls. Like if you go to sit and you hold on to the walker instead of the chair, that often leads to falls. And leisure activities. So often people who participate in more physical activities like walking or running or biking or hiking, they are prone to falling more. So what is the benefits of fall prevention training? It has been found that it has helped to reduce falls, reduce difficulties with everyday activities, and this is because there's less injuries. So they're able to still engage in things like self-care and chores around the house. It has been found that it leads to a 31% reduction in falls after 1 year. There is a shorter duration of hospital admissions, and individuals are less likely to have physical decline after 2 years. So by following and implementing fall prevention strategies, ultimately you are going to be safer and have a longer, more independent, and better quality of life. So it is fairly important. So what can we do about it? We can learn safe techniques. There's different home modifications, medication management, vision management, exercise, and the use of assistive and adaptive equipment. So some safety techniques. In order to prevent falls, we do not use the towel bars or the sink edges for support. So if you're getting up, don't use it for support because it can come apart. If water falls on the ground, especially if you have something like tile floors or hardwood floors, make sure to wipe it up right away. Know your limits if there's a task you cannot easily complete. So instead of powering through something, if it's too difficult, make sure that you get help and you make it easier. Prepare for weather. So there's lots of different daily apps. Make sure you know if it's snow or if it's rain that you have gear. So maybe boots with a non-slip tread can help you. An emergency call system. So make sure you have access to an emergency call system in case there is an accident. Also, when you are walking to a different surface, be careful to watch your footing. So a different surface could be like from walking from a hardwood floor to carpet. Make sure that you're careful and you pay attention to your footing. And when you are walking, especially across different surfaces, do not multitask, like talking on the phone while carrying a load of laundry. This can often lead to falls. So make sure that your tasks are very simple and you're focusing on them. Floors in the house. So some things we have identified that can be dangerous in the floors of the house is having steep steps. So you can modify those by having a ramp. If the carpet is ripped apart, that can affect you. So make sure the carpet is in good condition. Make sure the rugs have non-slip grip on the back. Remove throw rugs if they are a tripping hazard. So if they're turned up or if they're ripped in any way. Make sure some rugs are not curled up. So earlier we saw that it's easy for the rugs to get curled up. So that's also a fall factor. So watch out for that. Remove any electrical cords. In the bathroom, make sure you have a non-slip mat. And also inside of the bathtub, make sure you have a non-slip mat. And watch out for any uneven or slippery flooring. So if you have tile or hardwood floors, This can be slippery, so you can place a rug over that, a non-slip rug over that. That is in good condition. More things about the floors is we have talked about walk over different surfaces carefully, focus on walking, and do not multitask. For lighting is another important factor for falls. Make sure your house has adequate lighting, especially when we're walking around in the dark. We want to make sure we can see. You can place automatic lights outside in the bedroom and the bathroom. Another good option is night lights, especially in the bedroom and the bathroom. So when we get up at night, you can see. Make sure the switches are easily accessible. So you can get a remote control. You can place the lamps closer to you so it's easier to reach, such as the night lights with control. And another thing you can do is have a lighted doorbell so you can see where the doorbell is. So for the entrance to the door and the yard, you can have stable railings outside so you can hold on, especially if you're going through your bag and you get something. It can prevent falls. If you're in a wheelchair, you can have a wheelchair ramp. Make sure you're aware of the weather. It might be a good idea to have some kind of a cover over your door, especially if it rains a lot. And you can have an outdoor grab bar with lever handles. In the living room, we can focus on organizing the furniture so that it is easy to walk throughout the living room. Remove any kind of unstable furniture because this is a danger. Reduce the clutter. We don't want things on the floor. We don't want things causing you to fall. And make sure that there's an open walkway. So for the kitchen, another thing to identify is if the cabinets are too high or too low. We want to make sure that if they are too high or too low, we place items in easily accessible locations. So you might want to place the food at the bottom of the kitchen counter and not high up. For the things that are high up and hard to handle, do not use a stool, but instead use a ladder with handles. Make sure when you're cooking to remove any pets so you can put them outside. You can put them in a kennel. If you have difficulty with mobility or weakness, you can have a moving cart that you can place your items on to move it across the kitchen. Having cabinet door handles with a D shape can make that easier for you to open. And another option is having a rope tied to the handle. That will also make it easier to open. For the bedrooms, we want to make sure there's no clutter. Clutter can get in the way and can cause falls. We can add in grab bars maybe by the bed. Make sure that there is easily accessible shelves and drawers for clothing. So we want to make sure that our clothing we normally use is placed where we can reach it easily. You can organize it and make sure it's easy access. The height of the bed, we want to make sure that the height is good so we can lower or raise the bed. Having a telephone by the bed in case anything happens, and having a bed rail to hold on to can all help. For the bathrooms, we can install grab bars by the toilet. We can have a raised toilet seat if the toilet is too low. We can place grab bars in the shower and the tub. Inside of the shower, we can also have a bath chair. And with the bath chair, we can have a handheld shower head. Oftentimes this is high up and hard to reach. So if this is the case, you can have a bracket that holds the shower head and it can be placed lower so it's easier for the individual to get. Another important factor for fall prevention is medication management. So often, if you're taking more than one medicine, it can interact and create health problems that can increase your fall risk. So you can get nausea, you can get dizzy, it can be hard to walk, hard to focus, and this can increase the risk of falls. So make sure to speak with your doctor about how the medication is making you feel. Make sure that you stay hydrated and that you are following a medication schedule. So you can do this by using a timer. Another important factor to consider is vision management. So when walking, use a nightlight in the bedroom and the bathroom. So if you get up in the dark, you at all times have light and you're able to see. If you are in the dark, make sure you always turn on the light before maneuvering through the dark. Make sure to have your vision checked regularly by the doctor, and your home has adequate lighting that is in reach. So this includes things like the hallways and the stairs. We want to make sure that your house has good lighting throughout. Physically, we can do things to help fall prevention. So by staying active, you're going to help maintain your overall strength, endurance, and balance. And these are all things that are important to continue to be mobile. So to continue to be walking around safely, we need strength to hold our body up. We need endurance to keep walking, and we need balance, especially when we're going over the different surfaces. So some ideas that can help you stay physically active is doing Tai Chi. This helps a lot with balance and strength. Yoga, walking, gardening, and so much more. So make sure you pick activities that match your capabilities. So if you're having difficulty walking, don't pick running. If you're having difficulty walking, maybe you can try some weights at home, or you can try gardening, but make sure it's at your capabilities and not too hard. Also, we can have assistive and adaptive equipment. So if the doctor recommends you to use a walking device, make sure you're using it and make sure that you're using it the correct way. If you don't use it the correct way, you can get injured. If you are having trouble with balance, make sure you go to the doctors, and the doctor can refer you to have an assessment by the occupational therapist. So that's another option. So I want you to think about what we just talked about for fall prevention. What is one thing that stood out? So think about one thing that stood out. So how can you implement fall prevention today? So I gave you a bunch of different things you can do today, whether that's creating a schedule for your medications, having an exercise routine, learning how to correctly use your walking device. So think about something you can take today and remember that percentage. 31% of people after some time was found to be living normally and healthfully. So this is really important, and you can do things to prevent falls now. So some things that we talked about safety techniques, managing the home environment, managing medication, managing vision, managing the physical body, managing assistive and adaptive equipment. In conclusion, we can live longer and safer by preventing falls. And it is a very real concern, but it can be prevented. So falls, unfortunately, has a high factor that leads to death, but you can do something about it. So I suggest that you take steps to prevent falls. And I have included some handouts along with this presentation. Thank you.